Axilla is a four-sided pyramidal structure which is present in between the upper arm and the chest wall. Now, this four-sided pyramidal structure presents an apex, a base, and four walls: the posterior wall, the lateral wall, the interior wall, and the medial wall. First, we'll talk about apex, which is directed upwards and medially into the root of the neck, and this base is bounded by clavicle in the front, upper border of the scapula, and the outer border of the first rib medially. Next, we have the floor of the base of the axilla, which corresponds to the hollow, which is bounded in the front by the anterior axillary fold formed by the lower border of pectoralis major muscle, and on the posterior axillary fold, which is formed by the tendon of latissimus dorsi and teres major muscle. On the medial side, it has the lateral aspect of chest wall. Now, the interior wall is formed by pectoralis major muscle and pectoralis minor muscle and subclavius muscle. Now, posterior wall is formed by latissimus dorsi muscle, teres major muscle, and subscapularis muscle. The medial wall, which is formed by the upper fourth rib, 1, 2, 3, 4, and sometimes 5, the serratus anterior muscle, and the intercostal space. The lateral wall is formed by the tendon of biceps brachii in the bicipital groove of humerus, coracobrachialis muscle, and the short head of the biceps brachii. Now, here is the summary for apex. It's front clavicle, behind upper border of scapula medially, outer border of first rib. The base, front is anterior axillary fold, which is lower border of pectoralis major muscle. Behind there is posterior axillary fold, tendon of latissimus dorsi and teres major muscle, and on the medial side is lateral aspect of chest wall. Anterior wall shows the lateral pectoralis major muscle, pectoralis minor, and subclavius muscle. Posterior wall above we have subscapularis muscle, and below we see latissimus dorsi and teres major, as we have seen before. In the medial wall we have the first, fourth, or fifth rib. Then intercostal space and serratus anterior muscle, and on the lateral side we have tendon of biceps brachii muscle and coracobrachialis muscle. Now, if you want, you can take a screenshot of this. Next. Now, here we have the contents of axilla. On the anterior side we have pectoralis major and minor, as we have seen before. On the posterior side we have the latissimus dorsi and teres major. This is the posterior side of the anterior side. This is the lateral side, and this is the medial side. Now, we see the contents. Here we have the axillary artery. Here we have the axillary vein. Here we have the group of axillary lymph nodes. Here we have the axillary sheath and its content. And then also we have the fibrous fatty tissue, and that's it. Now, here we have our axillary artery. The first part of axillary artery branches into superior thoracic artery. Now, the second part branches into thoracoacromion artery and lateral thoracic artery. Now, this thoracoacromion artery further branches into clavicular branch, pectoral branch, deltoid branch, and acromion branch. And the third part, we have the subscapular artery, which is the largest branching. Then we have the circumflex scapular artery, posterior circumflex humeral artery, and anterior circumflex humeral artery. Now, we have the relations of the axillary artery. For the first part of axillary artery, on the anterior side we have pectoralis major and loop of communication between medial and lateral pectoral nerve. On the posterior side we have medial cord, long thoracic nerve, and serratus anterior muscles. On the medial side we have the axillary vein, and on the lateral side we have the lateral and posterior cord of brachial plexus. For the second part of axillary artery, we have on the anterior side pectoralis minor muscle. On the posterior side we have subscapularis and posterior cord of brachial plexus. On the medial side we have medial cord of brachial plexus, and on the lateral side we have lateral cord of brachial plexus. Then, in the third part of axillary artery, we have on the anterior side medial root of median nerve. On the posterior side we have radial nerve, axillary nerve, subscapularis on the upper part, and teres major in the lower part. Then, for the medial side we have axillary vein, ulnar nerve, and medial cutaneous nerve of forearm. Then on the lateral side we have musculocutaneous nerve. Now, we have two important clinical correlation. First is palpation of axillary lymph node, which we do as a clinical examination in case of cancer of breast. And second one is axillary abscess. This is usually due to infection or suppuration of axillary lymph nodes, and it can grow in considerable size. Now, the pus of axillary abscess may trap into the neck or into the arm even. So what we do is we drain it by giving an incision in the floor of axilla.